Good afternoon, everybody. My name is Jerry Riley. I'm the Design Authority on the Day UK programme. I'd like to thank everybody for taking their time this lunchtime to join us for what is our first Lunchtime Public Webinar of the Day UK programme. And this will be the first, I hope, of many. We want to be able to discuss what we're doing with the Day UK programme. This is the UKRI Data and Analytics Research Environments programme. Some of the key topics that come through and to really hear the opinion of the public. So today we're going to be focused in on what is the nature of a trusted research environment, why do they matter, and what is it that we're trying to do. Next slide. So our first speaker today will be Shishil Varma, who will be taking us through what is the nature of a trusted research environment and why they are important in transforming the landscape of how we do research on sensitive data, and why they're important to making sure that we can derive excellent public benefit from that research, but doing it in a secure way that is transparent and works in the public interest. And that's why we're having this conversation today. We really want to make sure that everything we do as part of this programme is done with full transparency, with clarity about where there's public benefit. And so we can have that discussion. You can raise questions, you can raise thoughts, ideas, and challenges. Fergus will then talk about the Day UK programme itself and what we're trying to do. So I won't try and steal Fergus's thunder this morning. And then we'll have a research use case from our colleagues in Northern Ireland, and we'll then open up then for plenty of time with Q&A and discussion. And as I said, this is step one. We will be having plenty of these. There will be other topics. So one of the things I would encourage you to do on the Q&A is to raise topics that you'd like us to discuss in future webinars. Next slide, please. Just a few quick rules. We really want this to be interactive. We really want to see lots of discussion and lots of questions. But as we go through the speakers, please can you remain muted at all time and keep your video off during the presentations. However, when we come to the Q&A, I'd encourage you to put your video back on, and you can ask your questions live. You can come off mute. But also, if you would prefer to raise your questions through the chat function, please do so. And do this throughout the webinar today, because I know often you see questions, you see thoughts as you're going through. So don't wait to the Q&A to start typing into the chat function. We'll capture those questions and we'll ask when we get to the appropriate point. So use both. If you feel more comfortable asking live, do so. If you feel more comfortable with chat, likewise do so. As I said, we really want this to be a very interactive session. I would like to remind people that we are recording the webinar today. We want to be able to make sure that this is available to those who are not able to join us today. So please be aware we are recording, and we will be making that recording available after the webinar. Next slide, please. So Fergus later on is going to talk a bit more about what we're trying to do with the Day UK programme. I just wanted to mention why we're doing the Day UK programme. Over the last 18 months, or actually now a little bit more of the pandemic, we've seen some tremendous opportunities to use research on sensitive data that spans health data and administrative data and economic and social data to really answer those questions that have helped us respond both from a clinical perspective and a public health perspective to the challenges of the pandemic. This has shown that there's clearly an opportunity to do this more broadly, and UKRI in the summer initiated the programme, the Day UK programme, to really look at how we could better approach doing research across sensitive data. And what we mean by sensitive data is potentially personally identifiable data. It may be de-identified, it may have been anonymised, but it started life as identifiable data that allows us to do cross-domain research on data for the public benefit. And this needs to be done with security, transparency, and public benefit in mind throughout. And that's why these webinars are so important. The objective of running the program is really to answer the question of how should a national data research infrastructure be designed so that sensitive data can be connected and analysed in a secure, flexible, efficient and sustainable way. So that's the question we're looking to answer, and that's the area that Fergus will go into in a short while. However, before we look at the DARE UK programme, I'd like to invite my colleague Shashil to talk through one of the core concepts that we're looking at here, which is the nature of trusted research environments. Shashil.
Thanks, Jerry. I hope you can see me. So trust research environments is a very complex topic, it's a very technical topic. So we're trying to keep this discussion at a higher level, just to give you the basic understanding of what a trust research environment is. But then, of course, if you have questions to go deeper, we're more than happy to do so. So next slide. So a trusted research environment is essentially a highly secure computing environment where highly sensitive data can be stored, analyzed, and outputs are also safely exported out from that trusted research environment. It's mainly used for analyzing sensitive data where there may be some identifiability risks for the health data, but sensitive in terms of commercial data or data that have implications for policy development. In general, TREs with that safe computing framework, where you have a safe data center where data is held, in general, it makes research safer, purely because some of the key fundamentals of trusted research environment is safety at multiple layers of the stack. So when we say multiple layers, we need safety at the people level. Who is accessing the data? How are they storing the data? For what purpose are they storing the data? So safe projects. What is the environment and the security perimeters of the trusted research environment? So the firewall, if you want to think of it as a castle, what is the moat and the drawbridge around that? What data is being used? So safe data. So is the data sufficiently minimized purely for the purpose of that research and not access to every data conceivable? And safe outputs. Once your analysis is completed, how do you export that data out? Trust research environments in that setting allows teams of researchers to come together to access sensitive data, collaborate, and be efficient and effective in generating outputs. Next slide. So I know this is fairly abstract, and so I just want to give you what the lay of the ground would be. The image on the left-hand side is Mare Nostrum in the Barcelona Supercomputing Center. It's one of the most beautiful data centers. It's within a church, and the entire data center is essentially where your data will be stored. These are the racks of servers that'll be there. You can go there today if you want to. There are data centers across the UK that store sensitive data and also non-sensitive data. Fundamentally, they're comprised of compute servers to analyze data to store, and networking to connect everything up. But you can also have access through a safe and controlled research environment. So one example of this is a safe pod network from ONS, where it's essentially a container where you go in, and through that terminal, you can access the data remotely that's sitting within the trusted research environment. So this combination together is what we call a trusted research environment. Next slide. And of course, you don't need to use a safe pod network in terms of container. You can access this from your desktop as long as the security is maintained from your desktop all the way to the data center. Next slide. So how do they work? They hold sensitive data from a range of different data sets, and they're originally collected for a purpose. So if it's health data, it's originally collected either in primary care or in secondary care, and it may be actionable with informed consent for access to for secondary use for researchers. There may be data sets that's collected from various different sources as well, environmental data, space data, and so on and so forth. But all of this data is collected for a purpose, and with consent of the subjects, if it is a subject, made accessible for research to be done on top of that data. We fundamentally use this 5 stage framework from the ONS to manage the security and authorization of the data within that environment. The 5 stages, again, to repeat ourselves, is fundamentally layers of security that we add on top of this data. So safe people, safe projects, safe settings, safe data, and safe outputs, making sure safety is paramount, and trust is maintained throughout these entire different safes as they go through. Researchers as well have to be approved to access data, so they have to undertake information governance training, they have to undertake handling sensitive data training so that they can access the data. And there isn't one TRE or one trusted research environment to rule them all. There is a multitude of ways of accessing data. And hence, each trusted research environment has a certain bias to the kind of data they hold, the kind of research they do, and the kind of sensitivity of the data that they perform. So the images on the right-hand side show you the, sorry, somebody was, so the image on the right actually shows you what happens when you become too liberal. When you make data fully available for everyone to use, you fear how that data is being used. But on conversely, if you hold the data completely securely, it leads to data hoarding. So there's somewhere in the middle where we want to keep as much sensitive data within the environment for research as possible, wherein we minimize risk. We will not be able to eliminate it fully, but the intent is to minimize risk as much as possible. Next slide. So what are the set of things that a researcher is able to do once they're in their environment? So they can search for metadata, they can find what kind of data is available, the dictionaries that's been used to collect the data, annotate the data. They can log in to that trusted research environment to access various different services, not just data, so compute services. They can discover a cohort of information, so particular subjects. They can request access to the data and amend and update their access request. They can transfer their code, which in of itself could be sensitive as well, into that environment for computing. They can run their analysis pipelines as much as they can within that environment, and then they can collect the aggregated results back out from that environment. But these are the main set of capabilities: so discovery of things, access to things, analysis of things, then finally communicating the results of their research to the wider public and to other researchers to benefit further research as well. Next slide. So one of the typical questions we ask, people ask us is, can my data be identified? And the truth is, there is no 100% guarantee. So there are multiple security monitoring processes to prevent your data being identified and misused. Of course, we can never give you a 100% guarantee, but the intent is, because of these layers of security, is to minimize the risk of identification and misuse. Furthermore, all trusted research environments have to comply to strict data processing rules and standards based on the sensitivity and the type of data that they hold, again, in alignment with national legal and regulatory bodies. Researchers themselves have to undertake accreditation to make sure that they are an accredited researcher who've undertaken information governance training and sensitive data handling process as well. So we add in as much regulatory checkpoints throughout the entire process and security checkpoints to make sure everything is being done as safely and as trustworthy as possible. Next slide. What are the benefits of a TRE? A trusted research environment typically adds value because you're able to access some data in a view that allows you to get bigger value from that data. It gives you a fuller picture of all of the data that's been pulled together. When data is pulled together and linked together within a trusted research environment, the researcher is able to look at a wider scope of data. So they can look at longitudinal data, they can look at spatial data in terms of spatial coverage, but also data from multiple jurisdictions and domains. So environmental data combined with health data to weather monitoring data is a good example. When this sensitive data is handled securely, research benefits. If you de-identify and completely anonymize the data, the value to patients and for research is minimal. So we're trying to balance these two things, safety and also trusted research environments and the utility of that data. And the access to sensitive data within a trusted research environment allows researchers to access it in such a way that they cannot do anything malicious and take away the data for their own purposes. So next slide. So what are the limitations? TREs are not a silver bullet. They are horses for courses. They support some type of research and sometimes they don't. Some data sets cannot be stored in trusted research environments because there are restrictions placed on the data by the individual data collectors themselves and the data custodians. There may be a limitation in the capacity of TREs to keep up with demand. So there are a limited set of trusted research environments that are able to hold data, and there's a huge, over 30,000 to maybe even 50,000 researchers, at least in the healthcare setting, but more beyond, to be able to access those data. And some TREs allow remote connections. Now we're in a pandemic. You can access the data remotely, but not all of them do. And some of them enforce the fact that you need to access the data in a physical, safe setting. So there are limitations, but the way we're working with HDA UK, DI UK, and as part of DARE, is to try and build a community together, to try and improve the quality of research that's done in trust research environments, maintain trust and security, and accelerate the way health data and other types of data is used within a wider setting. Next slide. So with that, I'll hand you over to Fergus.
Great, thank you very much, Sushil. So I will then be talking a little bit more about the DARE UK program and sort of a first view into how we want to answer the question that Jerry introduced earlier. I do see that there's a hand up, but again, we will take questions at the end for the Q&A. So if you could just keep it in mind, we can answer it a bit later. So in terms of what we're looking to do as DARE UK, there's sort of three, I suppose, fairly straightforward, let's call it principles that I want to sort of talk about today. And that's the fact that we want to design and then further deliver a national data infrastructure that is on the one hand joined up, and we'll talk about each of these principles. The second hand, it demonstrates trustworthiness. And then finally, that it, of course, supports research for the public good and at scale. So in terms of being joined up, what do we mean as the DARE UK program by joined up? So the first is that we need to have this sort of UK-wide network of TREs that is able to support research quickly and efficiently. And of course, we know that the pace today at which data moves, the amount of data that's generated, the speed at which it's generated requires that this infrastructure is able to keep up, so to speak, with that pace. The second point here is that it needs to work in a more joined up way so that we can realize greater benefits out of the research, so that we can maximize the benefits out of data research, and that we can also share knowledge and capabilities across the research ecosystem, if you want to call it that. It's very much adhesion to how this ecosystem as research is working so that we can ultimately deliver greater public benefit and take advantage of the scale that data offers. And then finally, some more standardized ways of working when it comes to access and governance. This is really just to ensure that we maximize as much as possible security and subsequently then the trust that we have to do the work that we're doing. There is a lot of good work that's already been done. So it's not to say that we're not starting from scratch here, definitely not. There's really a lot of good work that's been done across the ecosystem when it comes to this. It's just about trying to bring it a little bit more together so that we're moving in a little bit more the same direction. So that's more or less joined up. If we talk about demonstrating trustworthiness, obviously, and this is really, it's critical and integral to the DARE UK program, the public need to know that their data is safe and that their privacy is being maintained. So this is a non-negotiable, right? They also need to be informed of how that data is being used and for what purpose. So we need to, as a research ecosystem, make sure that we're transparent and effective at how we communicate how the public's data is being used and why. Of course, we also have data custodians who have, in a lot of cases and in most cases, actually statutory obligations that they need to fulfill when it comes to holding data. And so we need to be able to communicate with them how, the data that they've collected and are responsible for, are we keeping it safe? Are we using it in the right ways? And then finally, properly understanding what is considered trustworthy. So it's really critical that when it comes to trust, it's not something that we sort of, we tick a couple of boxes and now we're trustworthy. In the end, trust is given to us by you, right? So you have to give it to us and you can easily take it away as well. So we need to make sure that when we're, as we go through the DARE UK program and as we operate, we need to make sure that we're transparent with you and that we're consistently meeting your expectations when it comes to trust and the trust you place in us. And then finally, research for the public good. So as Sushil has alluded to a little bit already, there is always risk. So it's never that we sort of can do anything with an absolute confidence of 0% risk. And we've got to weigh that up with the benefits. So we have to also make it very transparent. What are the benefits to doing this research alongside what are the risks, and then make joint decisions about whether we accept those risks, considering the benefit or not. We need to make sure that research is answering the most important questions. So that means questions that the public have and in the interest of the public. And that's again why it's critical that we have these discussions and that we continue and will continue to do so within the DARE UK program. It's really, really important that we are answering the questions the public wants answered using what is ultimately the public's assets when it comes to their data. What I've sort of touched on already, balancing data misuse with the misuse or missed opportunity of using the data. So this is again talking to a little bit the scales of the benefit versus the risk, and do we accept that or not? And then finally, ensuring that the access and use of data is fast and efficient, so that we can realize the benefits for the public before the opportunity passes us. The world's moving quicker and quicker, especially when it comes to data. And so it's really, how can we make sure that we can realize the benefit while it's still relevant? So in terms of the DARE UK program, the DARE UK program is a multi-year program, but we're currently in phase 1, and this is running from July until spring, I believe in the UK, spring of August of 2022. So this is the design and dialogue phase, and it's really a very, very extensive listening phase where we're talking to researchers, technologists, yourselves as the publics, and a lot of other stakeholders, and really engaging and listening about where do we need to go, how do we need to do that, what's the direction we want to take. We have a number of sprint exemplar projects which we are currently closing until the end of the year, which are really there to, I suppose, investigate novel ways that we could do this in terms of the technology, in terms of the use cases that could be addressed, and also in terms of sort of the best practice when it comes to governance and the processes that we need to put in place within this infrastructure. Very, very important is the stakeholder and public engagement. So we'll be engaging with a number of stakeholders, as mentioned, and we will certainly be engaging with the public a lot more as we are doing today, and I'll touch on that, some of our plans in a moment. And then, of course, designing what we would call a blueprint, or at least the first draft of a blueprint, for a more joined up, as we've said, trustworthy national data research infrastructure. In terms of public involvement and engagement, as I've sort of said before, it's embedded throughout the DARE UK program. It's critical to us in order to succeed. So we need you, we need the publics. We can't go there alone, and we have to go there together. And we have to make sure that everything we're doing is for the public benefit, and that the infrastructure we design is ultimately delivering benefit for the publics. So how we are doing that so far in the program, we have 5 public contributors. So 2 of those public contributors sit on our program board. So that is the board that is steering strategically this program and the delivery team. We have 2 public representatives also sitting on our scientific and technical advisory group. So they are advising when it comes to the more technical aspects, the technology side of the program. They are sitting on that board, that group, to basically advise the directions we take as a delivery team there. And we have an additional public advisor who is really working quite closely with the delivery team, focusing on a lot of the public engagement activities that we're doing, such as today and what will come in future. We also have planned next year a public dialogue to discuss in quite extensive detail what a trusted and connected national research infrastructure should look like. These are workshops that we will be having in the 4 nations, and this will happen in January of 2022. Okay, maybe a last punt as well, if you would like to, feel free to visit the DARE UK website. We have all the work that we are doing is there, so you can go and have a look at it, and you're more than welcome to then, through the website, also contact us regarding anything there. All right, that's it in terms of the presentations. I hope I'm on time. I'm going to hand over now to Aideen and Trasa, who are here from our Northern Ireland colleagues, and they're going to just talk us through a specific, I suppose, use case of how linking data can really benefit the public. So handing over, I think, to Aideen, if I'm correct.
Yes, thanks, Fergus. I'll just wait till the screen's cleared so I can share mine.
Yeah,
Perfect. Yeah, so like Fergus said, I'm going to talk to you today very briefly about a program of work that I've been carrying out within one of these trusted research environments. I'm going to be talking to you today about how we've used that to use administrative data to better understand mental health outcomes within looked after children in Northern Ireland. And just to give a little bit of context as to why I'm looking at this group in particular. So Northern Ireland currently has the highest number of children in care on record, and over 3,000 children in care at any one time. So this is the highest number since sort of accurate records began back in 1995. And this story is the same across the UK. We're seeing increasing numbers of children in need and children who are removed from the home and placed in care. And we know that these individuals are at an increased risk of poor mental health. We know that children who end up known to social services or end up removed from the home and in care have been exposed to a range of adverse childhood experiences, not only whatever happened in the home that made them known to social services, but the care experience itself. And it's difficult to unpick whether it's those adverse childhood experiences or the trauma of being removed from the home, the difficulties within the care process, the changes and placements within the care journey that has an impact on mental ill health, or is it that these individuals end up known to social services because of their mental health status before? Now, research in this area to date has really heavily relied on surveys, and individuals in this group are known in the research world as children who are in a hard to reach group. And what that means really is that research on these individuals is very difficult to carry out because it's difficult to maintain involvement in research, especially longitudinal research. Children known to social services, children in care are quite a transient group. They move quite a lot. If I'm trying to do longitudinal research where I follow children over a period of 10 years, the name and address and contact details I have for them from 1 year may differ year on year. So the way to get around that, in order to stop relying on small scale surveys, which may not represent the entire group of children known to social services, but to use administrative data. So that's data that's already been collected for the provision of services. Now, Northern Ireland is quite unique in that we have an integrated health and social care system. And what that means is that our social services data contains your individual unique health and care number the same way as your GP records do, your prescription medication and your hospital data sets do. And what that means is that it's very easy to link these data sets up to gain a picture of an individual's social care journey and then their health outcomes. So I developed this program of work where we linked a range of these administrative data sets, social services data from 1985 to 2015, so it's about 30 years worth of information, to mortality records, to prescription medication data, which in Northern Ireland prescription medication is free, so we have information on every prescription that's dispensed in community pharmacies across the entire country. We have psychiatric hospital admission data and self-harm data, with the aim really to use this information to gain a profile of the mental health and profile of children known to social services. And this linkage created the UK's first population-wide longitudinal study of the long-term mental health outcomes of children known to social services. And this linkage was carried out within the Northern Ireland trusted research environment called the Honest Broker Service. And just as a bit of context to what this looks like, Jashil talked earlier about kind of safe pods. Now the trusted research environment within the Honest Broker Service is kind of like that, where it's two separate glass box rooms. There's a desktop computer in there that isn't connected to the internet. Researchers go in, they're supervised by Honest Broker Service staff, access the data securely, carry out your research, submit your outputs to the staff, who then check it to make sure it's not identifiable and clear it. Now, from the beginning of this research, we knew that we needed a steering group. We had this wealth of data that had never before been used for research purposes, that we needed a steering group not only to understand the administrative data that we're faced with, but also to help us develop correct research questions and ensure that we're asking the right questions of the data that we're looking at. For this project, we developed a partnership with the Department of Health in Northern Ireland, and on our steering group sits the head of Looked After Children and Adoption Policy in Northern Ireland, Elaine Lawson, and our Director of Family and Children's Policy within the department, Eilish McDaniel. We also have two very important stakeholders. We have from service providers, Bernardo's, Trasa Canavan, who'll speak a little later, and the Northern Ireland Children's Commissioner, Kula Yesuma. So the idea was that this steering group would help us develop what our research questions are as academics, and what information do those working on the front line and policy need, and how can this linked data set help inform that. So this research was not only just carried out by academics in their sort of ivory towers, picking research questions that are of academic interest, but the research questions were developed in partnership with the steering group, with the policymakers, with those on the front line. So we would meet triannually to help develop the research questions. As a researcher, I would go off then do some analysis, come back and present preliminary results. We would discuss the interpretation of these results, what that meant. And this was really invaluable for data that had never before been used for research purposes. We were beginning to see some trends in the data that didn't make sense to us as researchers, but individuals who are policymakers or those that work on the front line were able to give an explanation almost immediately. For example, we found that data quality really greatly improved in the mid-90s onwards. And the guys in the department were like, oh, that makes sense. That aligns with the UN Rights of the Child policies that were implemented. So of course then how we collected data changed and improved. We also found that data quality actually decreased around 2008 for a few years. We heard like, we don't know what happened then. And again, those policymakers and those working on the front line were able to say, well, that was the time of the recession. At that time, administrative support within social work teams was removed. So a lot of the data input was required by social workers themselves who had never done that before. And I suppose it took a while for those guys to get up to speed and improve the data quality. Not only that, we saw different trends across different health trusts that related to different policies within different trusts. And this direct discussion with the policymakers and those in the front line helped us to understand those. We then would go back, do some additional analysis, present the final results, and then we would disseminate it through our usual academic ways, but also help from the steering group to disseminate that correctly within the department so that everyone's sort of agenda was met. In terms of the results that we find, I'm going to touch very briefly on this because it may not be of interest to you, but what we found was that almost 1 in 10 individuals aged under 45 years in Northern Ireland have been known or are currently known to social services. So that signifies a large proportion of the population that are in contact with social services. We find 10 times the rate of antidepressant prescribing in looked after children compared to those children that were in their own home, not known to social services. 50 times the rate of antipsychotic prescribing, 25 times the rate of self-harm, and over 1 in 6 of all suicides amongst young people in Northern Ireland were amongst people who were previously known to social services. So all of this sort of information and baseline results helped us understand and see a sort of stepwise deterioration in mental health depending on your level of involvement with social services. So this graph here, we've got the grey line shows individuals that were never known to social services. The light green is children who are identified as a child in need but remained in their own home. And the dark green line is children who were identified as a child in need and then removed from their home and became looked after. This is your standard children who are in foster care, kinship care, or institutional residential care. What we found was that children that were known to social services as a child in need had worse mental health than those never known, and then those that were looked after had worse mental health again, and this was across the range of different outcomes. Now, this information helped inform the new Northern Ireland policy or strategy for care experienced children and young people. So the data that we were able to link here and actually for the first time look at a population-wide level, what was going on with the entire population of children in care in Northern Ireland, helped to inform the decision to improve mental health service provision within this group. We were also at this time contributing to the development of new strategies. in terms of practice and how this sort of research can help impact practice on the front line, we haven't at this point identified any sort of interventions or anything, but what we have found is that, like I mentioned to you before, within each of these data sets, we have an individual's health and care number, and that's what allows us to link the data so effectively. Within the data, we were able to look at the quality of the health and care number coverage and find that within the standard health data sets, your prescription medication data, your hospital data, that the health and care number coverage was almost 100%, it was perfect. But within the social services data, health and care number coverage wasn't as good. And what that means is that we need to have an accurate health and care number across all of our data sets to allow for linkage. If there's an error in the social services health and care number, it won't link. If it's missing, it won't link. And what we found was that around 10% of records were missing an accurate health and care number. This doesn't mean 10% of children, it just means 10% of referral episodes. So a child may have 100 episodes, and in 10% of those episodes were missing health and care number. And what this meant when we fed back to the department and the policymakers was that there's now a real push on the front line to ensure accurate data inputting upstream, so that further downstream, whenever we're looking at this data for research purposes, that it's accurate and can be used effectively. Now, our project steering group member, Elaine Lawson, couldn't be here today, but she's provided a few comments previously about the impact of this research. And she has said that, for me, evidence can derive from a number of sources. Evidence from relevant research is important. However, we also need to consider data, practice, and stakeholder feedback. All are essential for effective policy making. And I think this is really highlighted in how we're not just academics looking at data for data's sake. We're working very closely with policymakers and individuals on the front line to ensure that we are making the best use of the data to inform better practice. As a department, we regularly receive feedback from children's rights organisations and other stakeholders that the right data does not exist. So previously, we were relying very heavily on surveys and sparse surveys, and now with this data linkage, we're able to very quickly provide the right data. So if somebody from a children's rights organisation wants to know how many children in care presented with self-harm in a particular year, we're able to identify those numbers quickly. Elaine said she couldn't believe how much data is collected relating to children in care. However, it is in the main static. It conveys a picture at a point in time and doesn't necessarily track a child's journey. We need to examine data over longer periods of time. So this sort of understanding of the need to follow individuals over time and therefore ensure data quality is high over time has already been conveyed during our work with the department. Elaine lets you know here that the preliminary findings were available to further support the need for enhanced mental health services for looked after children and care leavers in the new strategy that I mentioned. And I'm going to hand over now very quickly to Trasa Canavan, who's one of our key stakeholders from Barnardo's, talk about her involvement in this research and how she feels it has been able to impact there.
Thanks, Aileen. Yes, this is a really interesting piece of research for Barnardo's to be involved in. And just to kind of give you a bit of context, Barnardo's Northern Ireland is the largest children's charity in Northern Ireland. And in the past year, we worked with about 18,000 children, young people and families right throughout Northern Ireland. So for us, it's really important to get data which evidences the feedback, the experience on the ground of children and families. And this is something that we've known for a long time anecdotally from what we see in our services, from what the staff tell us, from what children and young people tell us themselves, that there is that real link between care experience, young people, and mental health outcomes. But actually finding data which can show that, particularly data over a longer period of time to show trends and patterns, you know, it didn't exist really before now, and Aileen's research is really uncovering that and allowing us to demonstrate it so that we can develop evidence-informed policy, which is really important because when we have evidence-informed policy, that means that we can design services that actually meet needs, interventions that actually work and make a difference to children and young people. I think that's the second key part for us, is that this data is really interesting, this research is quite exciting, but at the end of the day, we're talking about children and young people and their lives. And it's really important that we don't forget that they are behind every single one of those numbers. So being able to use that for public good in the very realist sense is so important, that we can actually make a difference with this data. And I think Aideen touched upon that there. It's not just research for research's sake, or because it might be nice to know. It's because we can actually do better by our children and young people. And then just looking into the future, there's real potential for this research. It's something that we want to continue working very closely with Aideen on, and being able to use and understand different research questions will be very, very important to making sure we meet those needs. Thanks, Aideen.
Great.
Thanks. I'll come back to Fergus then.
So thank you very much, Aideen. Thank you, Tressa. I think we're more or less on time. So now we are going to our Q&As and discussion. So I will try to chair that as best I can with some support from my colleagues here. And I'm just going to, if you do want to ask a question directly, as mentioned earlier, please just feel free to raise your hand. You can also just drop a question in the chat, as I see quite a number of people have been doing so far. So jumping right into it, I see questions from Margaret starting at the top regarding sort of the accreditation of researchers, a little bit of the security checks made on a TRE. So I would almost bundle that into two things: the accreditation of researchers, how does that work? And then the accreditation to some extent of the environment, the TREs or the trusted research environment. So Sheil, yeah, can you take that one? Sure.
Yeah, so that's a great question. And I think those two parts of the puzzle are handled in slightly different ways. So the accreditation of trusted research environments, there are already some frameworks out there. So for example, the Digital Economy Act is a legal basis through which the UK Stats Authority, through ONS, accredits processors of sensitive data, but that's only limited to administrative data. It doesn't cover health data and other types of data. So one of the things that we're doing as part of DARE UK is to try and harmonize this so that there's a cross UKRI view of how you accredit trusted research environments. The second point, which is the main point of the question, is once you're accredited, how does that accreditation get monitored, enforced, and compliance is managed as you go through? And that's all part of the normal security disclosure practices followed by trusted research environments. They have to comply to those standards, and there is annual, if not biannual, audits for trusted research environments. So that's part and parcel of that accreditation process. In terms of accreditation of researchers, it's an interesting question because from our point of view, a researcher does not need to be an academic. A researcher is a person who has undertaken information governance training, or say is able to handle data sensitively, sensitive data sensitively, and also is accessing data for a well understood research purpose that is for the public benefit. If those two criteria are met, they are a researcher. So in terms of the accreditation process, it's fairly straightforward. You have to go through information governance training as step one. There are some extra checks and balances for some accreditation frameworks. So the DEA accreditation framework actually requires you to have a maths and stats degree. We're trying to make sure we're all aligned. For some health data or for some environmental data, you might not need a maths and stats degree, but you are able to handle data sensitively. So we're trying, that is another area of work that we're trying to promote best practices and align the different parts of the ecosystem to come together to address how trusted research environments are accredited and maintained, how accredited researchers are accredited and maintained.
Great, thanks, Sushil. So moving to the next question, I think here just James's question, may I have access to the data held to ensure accuracy of my health record? I suspect it is held in the TRE or in a TRE. Jerry, I'm going to give that one to you.
So yes, it's a really good question, James. So there's a really important separation of duties here between the trusted research environments and what we're looking at from a DARE UK perspective in building a network of trusted research environments who provide the research infrastructure and security around the infrastructure, and the responsibility of the data controllers around access to the data. The trusted research environments are not there providing that access to the data and the validation of the data. That sits fairly and squarely and remains sitting fairly and squarely with the NHS organisations, with the Office of National Statistics for census type data, Ministry of Justice, for appropriate data, Department of Work and Pensions, etc., etc. So the route to check validity of data is not through the trusted research environments. They provide the infrastructure. It is important that we do have data both from our personal perspectives of we want accurate data held on ourselves, but also as researchers, research needs to occur on accurate data if it's to reflect what's accurate results, but that is through the data custodian. So if you have a concern, it's actually around your electronic health records. Your point of contact to check the validity of data is through your health provider, your local trust, NHS England, etc.
Great. Thanks, Jerry. So just looking, Stuart, I think we've answered your question when it comes to criteria of who is considered to be a researcher. I think Sushil's touched on that already in his answer. Looking at the next question, how should accreditation, sorry, this is Paul's question, I believe. How should accreditation of TREs be handled? Would Dare UK want to get involved with this accreditation process?
Yeah, I think it's a great question. The honest answer is we don't know yet, but I think there is a lot of accreditation frameworks for TREs that's already out there. Some of them are mentioned, and it's an open question, and we want the public and the community to tell us what's the best way of undertaking this. There's clearly a need for it. There's a requirement for making sure that we have a joined up 4 nations cross UKRI approach for accreditation. But how that's implemented may be within DARE's remit in the future, but maybe another organization that can take over that process. We don't know yet. And we're trying to formulate that answer in the next few months and years.
Great, thanks, Sushil. So the next question, what place do lay people, so the patients, public, etc., have in the governance of such a technical environment? I've seen that there's a couple of questions here which I might want to group together. So that's the first one. Are the public involved in making the joint decision that benefit outweighs risk? And do the public have views on what a trusted and connected national data research infrastructure should look like? How do you engage people with this concept? So I'm going to sort of clump those 3 together because I think it's very much focused on sort of the PIE element. And Lizzie, who is our senior communications and engagement manager in the team, I'm going to invite you to come in here and comment as well. I would just start maybe before Lizzie jumps in by, I think it's really, really important that researchers, no matter how technical the topic is and how deep it could be, should be able to explain what they are trying to do and the concepts of what they are trying to do to the public. So I think the notion, and this is very much a Dare UK notion as well, the notion that it's too technical and the public can't understand this is not acceptable. We don't agree with it at all, and it's just not true. And researchers, and we need to find a better way as the ecosystem, the community, to explain what it is that we're doing, and not the other way around where the public need to sort of educate themselves. I'm not sure, Lizzie, if you want to jump in on those questions.
Sure, thank you. So yeah, the first couple were about how the public should be involved in kind of governance processes and making decisions about risk and benefits. And I guess a bit like the last question that Sushil answered, that's something that we want to kind of explore in this first year of Dare UK to see what is the best way for the public to be involved, how do they want to be involved, and how can this be as meaningful as possible. So that's really something that we're going to be exploring over the course of this phase 1. So it's a key question that we'll be taking to our public workshops in the new year, asking participants how they think the public should be involved. So it really is kind of a key focus of this first year. So we're not trying to kind of make decisions here without asking the community. It's really all about getting the feedback on how all stakeholders, the public, technologists, researchers think we should be working together on this. So that's kind of something to be answered during the year. And then the next question on kind of how to sort of make sure that we're engaging with the public around what is quite a complicated concept. Trusted research environments is not simple to understand. So as Fergus said, we just need to make it understandable. So the workshops that we're running in January, we're working together with some social research consultants who are really experts on kind of deliberative discussion. So we're having full day-long workshops where there's plenty of opportunity for presenting these concepts to our participants and opening up discussions, letting them ask as many questions as they want and need, so that we're really kind of discussing it together, so that they can have informed views on the issue, so that they fully understand what we're doing, to then give their views. So yeah, just to reiterate what Fergus said, it's really about just kind of making sure we're explaining it in a way that is understandable, rather than just assuming that it wouldn't be understandable.
Right. Thanks, Lizzie. And of course, we're trying to make it understandable, but you need to tell us if it is or not. So that's why we want to have a discussion, because you need to tell us, I don't understand what you're saying to me, and then we need to go back and look at that. Right. I'm going to hop slightly back to a question from Anthony here. How are you proposing to align with the NHS TRE working group, HDR UK TRE working group, the DARE UK, and also the Ben Goldacre report, which covers the use of TREs? Jerry, I'm going to throw that to you.
Okay, I'll take this one quickly, Anthony. We're working very closely within the Scientific Technical Advisory Group that we're setting up for the DARE UK programme. There will be representatives from some of the other initiatives present with that. We're in active discussions. So we're not looking for this to be a silo. We're actually looking for a lot of the DARE UK piece here to pull together some of the other threads. Importantly, they're threads, though, that span across the research domain. This is not a health initiative. And whilst many of us come from the health data side of it, this is an initiative to make sure that we have a strong, robust, transparent approach across data, whether it's from the health data space, it's from the administrative data space, it's economic, it's social, increasingly even into areas like climate. There's data we need to bring together across a whole space. So yes, we will be working with the other initiatives from the health space, and as you'll know, we're very closely aligned with some of those, but it's also we're pulling in initiatives from the broader research community in the UK.
Yeah. Thanks, Jerry. So then a question from Stuart for Aideen. How did Aideen or the steering group know that the data quality decreased, and how did that decrease manifest? So I'm not sure, Aideen, if you want to jump in there.
Yeah, thanks, Stuart. Can I just actually comment a little bit slightly on some of the questions that have been asked before about my experience? Just in that the trusted research environment that I used was within the infrastructure of ADR UK, so Administrative Data Research UK, and ADR Northern Ireland. And they already have, I suppose, I think what's important, and I don't know if it's understood, is that the trusted research environments already exist under a range of different infrastructures. So when it comes to things like accreditation, we use within ADR Northern Ireland the formal ONS accreditation. ONS has its own formal processes for accrediting researchers in terms of PPI involvement and how does the public deem a research project to be of interest or not. Within our application process for a project that goes to the governance board or the Honest Broker Service in Northern Ireland, RTRE, and within that sits a couple of lay members who will have the opportunity to offer questions about the importance of the project. And not only that, you have to have non-academic stakeholders as well to ensure that it's for public good. So I just wanted to offer that up in case people were interested in how my particular research project came about. In terms of how do we know about the data quality decreasing, two things. One was health and care number coverage itself. So we would see the proportion of individuals who had accurate health and care numbers each year. Most years it was fairly high, some years it fell off. And we were like, oh, what happened in terms of health and care number coverage? Because as soon as health and care number was lost, we couldn't do the data linkage. The other was to do with completeness of the data, where there's a range of different variables relating to the child, relating to the individual. You know, there's the key ones about the date, you know, their health and care number, the reason they're known to services, the social services, the intervention that's been offered to them in terms of foster care, kinship care, etc. Then there's lots of additional variables that were maybe missing. So You'd have additional reason variables, you'd have outcomes of investigations that would be missing. So where some years you would have, in some records, you'd have full data for a whole episode relating to a child, other times you just have the bare minimum. And the third thing was, we do have sort of national census of children in care every year, every March. There's a sort of census that says how many children are in social services at this point in time. And we would compare our numbers against that. And sometimes, some years, our numbers would be much lower than expected. And other years they would be aligned with the national statistics. I hope that helps.
Thank you. Thank you very much, Aideen. So we're slightly over time and we want to move to the polls now. I do know that there, I mean, I see a lot of Will, Stuart, Fiona, Ashra. I see a lot of questions still coming through. What we will do is we will keep a record of the questions, and we will answer those questions. I think, Lizzie, will probably publish those on our website, or how would we? Anyway, we'll certainly answer the questions and then we'll communicate how we would do that, right, Lizzie?
And if you've got additional questions, I know often when I sit on webinars, I come out of it with, contact us through the website, send us an email, inquiries@dayuk.org.uk. So send us contact through the website. We want to have discussion, we want questions. So feel free to continue asking them after the webinar's done today.
Yeah, absolutely. And even I saw some questions regarding attendance of sort of future public events, the workshops in January. Again, just go to the website, get in touch with us, and we can discuss it that way. So thank you very much for all the engaging discussion. And it's, as said, it's really only the first of many more. I think, Lizzie, we're probably going to jump to some polls now, just to get a pulse check from everyone, sort of if that was valuable, more or less.
Yeah, so we've only got 1 minute left, unfortunately, but maybe if you're able to stay for another 2, then please do, because we've just got some quick polls that we want to run through. So if you can grab either a smartphone or just another tab in your internet, if you're able to, otherwise you can just watch and see what comes up. So if you go to slido.com and then you put the number in 855856, then there's just a couple of quick polls just to see whether today has been useful, really. And they will then come up on the screen. So once you've logged in, the first question that will come up will be, what was your existing knowledge of trusted research environments before today? And this is really just to help us know whether we're kind of going in the right direction with how we're explaining trusted research environments, or if we need to do a bit better. So I'll just give it a moment or two just to get your thoughts in there. So it looks like for most people, it was not a completely new concept, but thankfully for those of you who weren't aware of them before, it sounds like we've helped, so that's good to know. Just give it one more moment. Okay, so I'll go on to the next question. So the next one was more about the Dare UK programme. So how well do you feel you understand what the Dare UK programme aims to achieve after today's webinar? Okay, so it's looking like most people are saying somewhat well. So we need to do a little bit better to reach the very well, but it sounds like we're getting there. So we'll think about ways that we can make that clear in future events as well. But that's good to see that we're kind of getting across our aims in general. So thank you. And then the final one is a little bit of a longer one. It's just but a very useful question for us, is to get kind of first sort of thoughts about what you consider to be trustworthy in terms of a trusted research environment. So it's this is a ranking question. So what would increase your trust in trusted research environments? So I think you just have to select them all and then you can rank them. So direct public involvement in data access and governance decisions, publicly accessible registers stating who has used what data and for what purpose, greater public communications, so more like news and events around what data is being used and for what purpose, stronger data security and access restrictions, and finally UK-wide standards with all TREs following the same rules and regulations. So I'll just give a couple of moments for that. It might take a bit longer to get those ranked. So at the moment, we've got publicly accessible registers coming up top. And UK-wide standards just slightly behind, but it looks like they're all pretty important to everybody. So there's not much between them, to be honest. But that's just some really useful insight for us to kind of take away after this. Great, okay, I'll stop there because it looks like people have finished voting pretty much. I'll just leave it open though, so you can continue in your own time if you do want to. But yeah, that was it. So we've got a few minutes over, but thank you very much for sticking around and doing that with us.
Yep, thank you very much to everyone for taking the time.